Hello, everyone. Welcome to Spectrum Talks, physical therapy podcast with your host, Sandra Terrazas. I'm a physical therapist and CEO of Spectrum Therapy Consultants in El Paso, Texas. I want to do a quick disclaimer. This podcast is for informational and educational purposes only, and it should not be replaced with any type of medical treatment. So always seek out for help when you need it. Hi, welcome to our second podcast about physical therapy. My name is Sandra Terrazas. I will be your host, and I'm also joined by Kim Sanchez, and she will be my guest today to discuss several different topics that we have in mind for you. I want to thank everybody who listened to our first podcast. It was about what is physical therapy. So we followed up with who are the physical therapists and the key players that are in that field. And today we're going to dive in further and go over all the requirements that it takes to become a physical therapist.
And if you haven't listened to the last episode, make sure you go and listen because it was really awesome.
Great. I think we have a lot of valuable information for those people seeking a career in physical therapy. So now we'll go into the parts that have to do with all that. And I want to start with saying that I am a faculty member at the University of Texas at El Paso's physical therapy program. And I'm an adjunct faculty at Western Tech University and also at El Paso Community College's PT assistant programs. So I'm a guest lecturer at these locations. So I'm in the trenches of what all these students are seeking and how to make them better candidates at what they do. And so Kim is in that process right now. So her role is vital in that. So she'll give you her feedback and ask all the questions that students are wondering, what is appropriate, what isn't, what should I do, what makes me a better candidate, any input, and so on and so forth. So we'll go ahead and get started with that. I think this will be a great episode for those of you trying to pursue a career in physical therapy.
Yes, because definitely that whole process has been really stressful, but I've found comfort while working here, being able to talk to you, being able to talk to different faculty at UTEP. I'm happy that I'm a talkative person because I'm able to build relationships pretty quickly.
Great. So I think I'll let you, Kim, start with, we all the programs have specific requirements to get into the PT program.
Yes.
So let's just talk about the academic part of what's required. And I know the PT assistant programs are a little bit different, but for the most part, we know it's a lot of science and math-based emphasis in this. So let's just talk about that part, and then we'll talk about all the other components. But the most important part, of course, is going to be a GPA. And so let's talk about the courses and what those GPAs actually mean and what reviewers are looking for to make applicants be appropriate candidates. Yes.
So to break down some of the classes that I've taken, it's, like you said, a lot of science-based, anatomy, physiology, Chem 1, Chem 2, both bios, which all were really stressful in the sense that it's not, of course, I'm interested in science, but the second part of bio, it's more about animals. And so trying to stay engaged with all that has been difficult, and wanting to get A's because, like you said, GPA is so important. Do you think GPA is all that they look at?
No, I think it's a great starting objective point. Mm-hmm. I think when you're in the academic setting, there are certain expectations and some correlations of students having a strong GPA with being able to fulfill and graduate from the program because it's rigorous to be in part of the program. The other thing is the licensing exam is what really determines whether you're a licensed physical therapist. So technically having the degree means nothing. Really does. In order for you to treat patients and see patients, you have to be licensed. And then that's the big exam that has to happen. And so although the exams themselves represent the end result, I think getting there, the GPA and the GRE score are vital in being an appropriate candidate.
To go back, I think I scared myself a little. So what you're saying is I can get through PT and be a DPT, but not be a licensed PT.
Correct. Correct.
Oh, goodness.
Good. So it's not like today, actually, UTEP is having the white coat ceremony for the 2020 graduating class. And all those students can definitely apply for a job and do whatever they want to do. But everything is contingent on passing the exam. And so if you don't pass, there's other opportunities to take it and certain requirements based on how bad you failed. Mm-hmm. And that determines finally, how many hours of continuing education you have to take before you can retake the test. But at the end of the day, if you don't have that license, you cannot practice.
Is there like a grace period where someone that graduates from PT school, they have this X amount of time before they need, is there like a license you can practice, I don't know the name of it.
No, let's go back and we'll talk about that at the end because we want to stay positive and making sure that everybody's going to pass and not freak everybody out that they're like, oh my God, I did all this for 7 years and now I can't even see a patient.
Well, on the bright side, I know that UTEP's DPT program has a 100% pass rate. Okay. So that's also a good thing.
Good. So I think since we're talking pre-T and pre-PT and then building to actually being in the program, I think it's important to note that the prerequisites are heavily science and math based. There's a lot of psychology associated with the prerequisites required. I encourage everybody, whoever is seeking that career path, whatever school you decide to apply, to go on that school's website and they have all the requirements listed. And so besides getting the mandatory requisites that are required, now you have to have a degree first. Mm-hmm. And then you apply to graduate school to get into the PT program. So the GPA is important at the point where you're in your undergrad. And that is part of the challenge in getting into the program with the right GPA. The second thing that is involved is basically a statement of why you want to be a physical therapist. Mm-hmm. And the big generic question or big generic answer to that question has always been, well, I want to help people. Okay. And everybody can help people in every different method. Yes. A housekeeper helps you helps people by keeping our clinic clean. You can help people by serving burgers at a burger joint. So it's pretty generic to say, well, I just want to help people. Right? And so you have to really explore deep inside what's the root of why you want to be in this profession so that it becomes a passion.
Right.
Okay.
Oh yeah, for sure. I mean, I think it's hard. The hard part is because I'm currently going through that right now. Why is PT? And I feel like I've identified by it for so long since high school that it's just become part of my life. And so having to put that into words and to express your passion so that the reader or whoever's on this committee that's reviewing your application can see that.
And it's not just what you put in words, it's what you experienced that puts those words together.
Yes.
So part of what's required is that there are 50 hours of observation under a physical therapist. Mm-hmm. And I encourage students to go to different venues or different clinical settings to see what physical therapists do in an outpatient clinic. What do they do in a hospital? Right now, it's really hard to get into a lot of places because of COVID.
Yes.
And so the experience factor is an issue. Many years ago, it used to be 150 hours.
Wow.
And now it's down to 50. But I encourage students to have beyond the 50 because it pads your application, that you're going above and beyond. The other thing that we don't want to see in an application is a student who's just brilliant and a big nerd and has no social aptitude or community involvement. Mm-hmm. So we need to see a well-rounded individual that volunteers at their church, at a food bank, that helps with a Little League basketball team or Little League baseball team, that they're well-rounded and have other interests.
Right. I was just having that conversation with one of my professors is part of the reason I love helping people, which is basic kind of generic answer. But I think it shows in all the other stuff that I'm involved in. I'm in student government. I like leading at the university. I'm in the Pre-Physical Therapy Association. I like pushing students to not be commuter students so that they don't just go to school and go home. They get more involved because that also plays into your college experience. So I think all the other stuff that I'm involved in at church and, you know, at school, that also shows for me wanting to help people and me liking to selflessly do things for others.
Sure. It makes you well-rounded. And then if you now attach the academic preparation to your personal statement of the experience, and then the leadership, we want to have leaders out there, and that you put that whole portfolio together. We had gotten away from interviews. Before, once you applied, you would actually have a physical interview. And for many schools, because of the number of students that were taken in and so on and so forth, then they decided to do away with the interview. At sometimes it would create biases when you would interview somebody. So they wanted to have a more objective platform. And so in some schools, there's still interviews. And so, you know, somebody can be great on paper. And when they present themselves, these are students that you're going to have in your program that are going to be hands-on with patients.
Right.
A lot of what we do is very intimate in manual therapy, where we're touching our patients. And if you have an aversion to somebody who has body odor, or somebody who is hairy, or you're in a hospital and somebody's soiled and you got to get them up, and you have an aversion to blood or bodily fluids, right. and you don't see that in you don't see that in a piece of paper. And
right.
So that's why we want students to have those experiences, to be sure that this is what they want to get into. The ability to get into PT school is very competitive. Anywhere from 4 to 6% of students who apply actually get in. Yeah. The classes are small, and by small, 40 to 50 students, and it's once a year that each class is brought in.
Right.
So it's with great. I hate to be in the application committee of who decides who gets in or not, because you have to find the most appropriate candidates that you hope you got right on paper, that will fulfill their 3 years to graduate. And there's this big social responsibility to make sure that you have not only graduates, but that you have graduates who pass their licensing exam.
Right. Because
at the end of the day, employers like myself and society and our communities need these licensed therapists to take care of patients. And so it trickles down. If you don't have the right candidates and you don't screen therapy students well, then they don't graduate, and now you're going to have a shortage of staff,
of
PTs in your community.
And there
with
already
all the
is
needs.
one.
Yeah, there has historically forever been one, and I think there will forever be. It's not yet fully saturated because we have a active aging population, and so there will always be somebody who has some kind of physical impairment that would need help.
Do you think that because it's so competitive, do you think these programs should open it up more, or should it stay competitive as it is?
It's not necessarily by opening up more. I think there is a big shortage of qualified faculty.
Okay.
So you can't make bigger programs if you don't have qualified, appropriate faculty.
Candidates. Oh, faculty.
Faculty that can teach a greater number of students.
That's true.
I think that's the biggest issue. And there's always shortages of qualified faculty. And so there's certain people that have a passion for teaching and that are therapists, and some that don't. And so it's part of it is the faculty shortage to make bigger classes. And the other part is we're so involved with one-on-one techniques that you really have to have the teaching and practice of hands-on. And if you have a whole lot of students, then it dilutes that teaching experience.
What's, I guess, one thing that you see me work, you've seen me as, I kind of tell you about my student life. What's one, I guess, advice you would give me as I'm going through this process? Well,
I think somebody like you who came to us as a volunteer, and now we've hired you as a technician, it gives you a whole different level of experience because you can actually touch patients now.
Right.
So that gives you a whole different experience. And I think all the students who are, I can tell when I've done this for 27 years. I can tell when a student walks in who's going to end up going into a PT program. I know that kid is going to be a volunteer who we hired as a tech, who goes on to PT school that we then hire as a PT later. And so I just know. It's like this sixth sense of So how do I know? I know because they ask questions, because they're involved with their patients, because they ask, a rotator cuff after 1 month, what happens thereafter? And then I give them things to look up and research, and they do. And so they're involved and engaged. Or if you have something to tell them or teach them, they're attentive to learning. and then I hear it later applied to another patient with the same diagnosis. So I can see that growth, and it's your own little professional growth as a tech who became a volunteer who became a tech. So, and knowing that you do all the other things that you do, and then suggested that we do a podcast and bring that into our practice is also a big plus, because it shows a different perspective of now the business and the marketing of physical therapy, which is a whole different beast, And so I think that you would be a great candidate. And I would say, not knowing what your GPA is or anything, I would say if your GPA is great, then you're going to be a great candidate like everybody else. And so the line of great candidate is really, really thin. So I always make sure that students really pursue getting that A and that B, and C's are really frowned upon if they're in your math and sciences. I've often said, you have to, if you want to really want to fix this, try to retake those courses to show the effort that, I screwed up here, or I might have had to work 3 jobs at the time, and that's the excuse for my C, but I'm going to make this better and try to rectify that void.
Correct. Do you think that this is going off of GPA, but do you think that the people who sit on the committee, I'm sure you've talked with a lot of them, do you think that they're understandable of like different scenarios like that, where maybe a student was going through something personally, or is the student ever given an opportunity during the application process to like justify that, or that's not really a thing?
It's a great question, and it is, and that's what comes in your personal statement. Okay. And that's where I encourage students to say, despite my GPA being a 3.7, all my semesters, you can see that my third semester I have a B or a C, and or I had to do 4 withdrawals at that time, whatever your personal circumstance was that could justify perhaps why that happened, and then that you turned it around as soon as everything else turned around. I mean, you students are going through financial issues. You're going through growing pains of just being baby adults and entering life. And so life happens, so it gives you that opportunity to do it then. And at the time of interviews, that was the perfect platform for that to come up, because you're asked, is there anything else we should know? Or is there anything you'd like us to know about you that would make us have you as a candidate into our program? Then that's when was the opportunity to bring that up.
And then also, I'm sure from the interviews, you could probably see like the persona of the person, right? Like how you said, someone might look great on paper, but they may not have social skills, or
and we would also see during the interviews the opposite effect. True. They're mediocre on paper, but God, they have that drive and that personality and the charisma. Where you just like know. And you're like, oh, they're just going to melt with their patients, You just know. So it creates there is a bias. Anytime you interview somebody, there's a bias. I don't care what anybody says. You try to be objective, but you're going to identify with what you're looking for. Right. And so once the choice of who goes where, the pool over the years has gotten so much better because there are more schools to apply to, number one. There are more candidate slots available at each of those schools. Sure. And so now the application process is also where it's like a standardized application, and then it gets zipped out to the different schools that you choose, where before you had to apply individually to every single school. Yes. And so now people can actually get accepted into 4 different programs, and they get to choose where they want to go, but that opens up 3 slots for somebody else, somewhere else. So I always encourage students to apply to multiple programs, because even though you really don't want to go there for financial reasons or distance reasons or whatever your motivation may be, you may not get where you want to go. You can have another place to fall back on. You may get on an alternate list, and then they might call you, or people coming to the school that you really want to go to maybe don't decide to go to that school. So that makes a huge difference.
Don't put all your eggs in one basket.
Exactly. And so that's also very helpful. I think the other thing that most students don't think about is, well, what if I don't get in? Yes. And what if I don't get in the first time?
Dun. No one likes to think about that, Sandra.
Exactly. And here's why it, quite frankly sucks.
Yes.
You apply and you graduated already and you did everything right and you don't get in. And then what do you do that year? Yeah. Okay. Because that's what you really wanted to do. What do you do in that year that you don't get in before you can reapply again? And so some of the schools have different application dates. So you might not get in somewhere, but 3 months later might get in somewhere else. That's why apply to multiple schools. And then if you don't get in, you need to really look at your application, share it with somebody who can look at it with you, that knows better than you, to say objectively, you know what, your personal statement doesn't shine, okay? Or your grammar for this or that, you really need somebody to look at this better. And somebody might need to say, take your GRE. I always say, take it 2 or 3 times. You have nothing to lose, to try to get a better score, okay? Right. Even before you apply, because then you just have to time it just right so that your scores go in before the application process is closed. And so then look at your hours of observation and really see what you can really
improve on.
I would also ask, and schools can certainly give this information to, what is the average GPA of everybody who gets accepted into your program? And if you're seeing like 3.8, 3.9, and you're coming in with a minimum requirement of a 3.5,
yeah, it's something to think about.
Something to think about, because GPA is weighed heavily, and so is the GRE. So if your GRE is mediocre, but it's the minimum standard, but everybody's coming in at
at the high end of the scale,
then that makes a difference, and every class is different. So I would always say, apply to multiple schools and then figure out where your deficiency might have been to really make that a better case for you the next time. And also plan what happens if I don't get in the second time. Okay.
Yes.
So I'll tell you what I have seen historically for those students who don't get in the first or the second time. And this has now put a burden on the PT assistant programs. So those people who really find a passion in this career, who for whatever reason can't get into PT school, sometimes it's the freshman year that screwed everything up for you. Okay, that GPA, there's just no point of no return for that whole year, or that you finally grew up 2 years into the program and really like, this is what I'm going to do, but it might be too late.
Yeah,
it really, that could be it. Many of bachelor's degreed students decide to pursue a career in the physical therapy assistant program. So before the physical therapy assistant programs were students going into community college or Western Tech to take basics and then become a PT assistant. And those students didn't have a degree. That was going to be their end degree. So now what we're seeing is those students with bachelor's degrees in kines or biology that are prepping for PT school decide to go get an associate's degree as a PT assistant. So they're still in the field. And they're highly regarded candidates because they have the academic preparation to get through a quote-unquote associates-based program, but now it's just really specific to PT. And so you see probably, I would say maybe half of the classes in the PT assistant programs, their students are already going in with a bachelor's degree in something else.
Do you ever see like those students later on, after, I think it's a 3-year requirement, they go on to a bridge program, or do they usually just stay in the PTA?
Good point. At any point, whether you have a PTA degree, you can apply directly to PT school if you have the prerequisites. So you're going to go through that same process that we just discussed, but now you're a PTA, so maybe your GPA was mediocre, but now you have all this experience, okay? And so that might allow you to have an edge on somebody else who doesn't. And many schools have now created bridge programs. In Texas that I'm aware of, there's only one, and it's UTMB in Galveston. And this requires, I believe, if I'm not mistaken, a 2 years of practice in the PT setting as a PT assistant, and then you apply for a bridge program. And that basically is like literally a bridge. You were a PTA first with the intent of becoming a PT. And it's also competitive because now there's a lot of PTAs wanting to do the bridge program, and there's only one program. And some of it is remote, and some you have to be there for school, so that student or that PTA who's now a PT student in the bridge program has to have the capabilities of travel and being able to engage with being a student. And part of what they have to do is still stay employed. So they practice what they learn, and they have to do clinicals as well. So that's another avenue should you not get in through the traditional method of the PT program.
Well, I'm hoping that I get in this year. I think all of my mentors, you included, I've learned a lot from talking to you guys, and different advice you guys have all gave me, and I'm hoping that, like you say, I'm a good candidate and that they see what I think I have. But
yeah, absolutely. And I hope you get in as well. And and I think we'll kind of wrap up with what we kind of went off on a little tangent with. So now you graduate. Now you're a PT. Mm-hmm. It doesn't matter unless you pass the board exam. Okay.
Yes.
So you have to be licensed, and that's a whole different beast of rules. Most exams are twice a year. So there's a set time where the university has to submit all your paperwork, and typically it's going to be in the middle of July for this graduating class. So all the university has to submit is all the transcripts and all the paperwork. The student does a formal application, does fingerprints, and does everything that's required to actually sit for the exam. And then once you sit for the exam, it takes maybe 2 weeks to be notified whether you passed or not. And if you passed, then you're given your license number, and off you go,
into the world
to practice your craft and pay taxes. And so that's the traditional trajectory that you hope everybody has. And if if you do fail, then you have to reapply to resubmit to sit for the board exam again. And I think the second time it's like, nerves, anxiety, we'll let it go. And then the test could be maybe in another 6 months though. Okay, so you have to wait
the whole time.
So and it's also some time to make you study better and be prepared better. There are courses for test licensing prep courses, so that you're encouraged to do that. And then if you fail a third time, then it's dependent on how many points off you are, that they require mandatory continuing ed courses that you're forced to take.
Oh, wow.
That you have to pay for, and in some cases obtain a tutor, and that tutor has to be a licensed PT. And then that PT will then submit that, yes, they tutored X number of hours, and provide that documentation for you to sit for the next exam. If you fail again, it's more of everything. And the last I heard, it's 8 times if you fail. And at that point, then
that's it.
Then you have to retake a whole program again.
Oh, yeah. The goal is to pass it definitely the first time.
Absolutely.
Study my butt off, and off I go.
Yeah. So, and then once you're done, you're done. I mean, that was the journey, and the end result is for you to be passionate about the work that you do.
Right.
I think the last thing that I didn't mention is for the prep, really take advantage of the GRE prep courses. A lot of people are not good standardized test takers. And so, use every opportunity that you can to prep and pay for the resources that are available to do that. So that gives you the perfect storm of going in the first time and getting it done right the first time.
Yes. Yeah, I've been using Magoosh. I don't know if you've ever heard of it, but it's a online. You put in how long you're planning from that point, how long you're going to take the GRE. So say you're prepping for 4 months, and then it breaks down the study for 4 months.
Perfect.
Yeah.
That's great. And like for me, I'm not in that. I've been out of school for 27 years, and so from PT school, 27 years, and so there's a lot of things that I don't know that you guys are great resources. I know that you were in some organizations at UTEP. I started with 3 other PTs and organizations called SPOT, Students of Physical Therapy and Occupational Therapy, and so folks who are in those clubs and so forth have that vital information to teach the people below you.
Yes.
I think we should always be good mentors to everybody. At some point, you're a mentor for the freshman who's just starting college, or for the high school senior who can't even figure out what they're going to do with themselves. So I think if you have that social responsibility to be a mentor to those kids, I think it goes a long way.
Yeah, I mean, we can always share whatever our knowledge is. It's always important to share it.
Well, good. So I hope that we can, at some point, come on back and give everybody the good news that you got into PT school.
Yes, definitely.
And also that you're willing to share all this information for other people who are going to be competitive candidates with you. But sharing is caring, and I think if you're meant to be in this journey, you'll be here and you'll get there, and we'll hire you one day. You can come work for us.
Definitely, I would love to work. That would be a cool a cool thing to be a volunteer, a PT tech, and then a PT.
Perfect. Well, that wraps up our podcast for today. Hopefully many of you could gain some knowledgeable information on this and ask us any questions and shoot us an email if you'd like. Go to our website, and I can also get you Kim's contact information for her perspective on her area, and that will be helpful for you to communicate with her as well. Thanks again, everybody. Have a great day.
Thank you, guys.